Hi everyone, today we are going to talk about vitiligo, which carries a lot of social stigma and psychological impact. Vitiligo is a disease in which there is depigmentation or less pigmentation of certain areas of the body, which is also known as hypopigmentation of the body. Since people suffering from vitiligo are really impacted psychologically because of the disease burden, they always try to find out the options that can be used as a treatment. There are various options available in the market these days that can help to regain the color in vitiligo. They can be medical management or they can be surgical management. However, I'm going to focus mainly on the surgical modalities, how you can achieve the pigmentation back onto your skin. So there can be a few grafting techniques and there can be a few non-grafting techniques. So let us talk about non-grafting techniques first. Non-grafting techniques consist of dermabrasion. Dermabrasion is the most common method that is used to get the color back in vitiligo. In this method, we usually rub the recipient area. We just rub the area with the aluminium crystal, damage the superficial skin, and hence it is stimulated to get the color back from the normal peripheral melanocytes which are present in the margins of the patch. Then we talk about the camouflage technique. Camouflage technique, there are various colors available in the market which are known as derma colors. They match the color of your skin and you apply that as a makeup, like a concealer. You apply it dab on your skin and then you can match the color with your skin, and hence you can hide the patch which is there on your body. Two other ways how we can get the color back is the CO2 laser and erbium YAG laser. Again, in these we damage the patch, vitiligo patch, with the laser therapy, and hence the stimulated melanocytes in the peripheral margins of the vitiligo patch gets you the color back on the surface. Now next is the cryotherapy, where we use liquid nitrogen at a freezing temperature, in which again the vitiligo patch is stimulated by giving liquid nitrogen to the patch, and hence the color is gained back by the stimulation of the melanocytes in the peripheral margin. Then next is the PUVA therapy. PUVA therapy is a very common therapy given by the doctors. They are the specific chemical agents that are given in the form of roll-ons or tablets to the patient, and then the patient is asked to go in the sunlight, and which helps in gaining the color back at the patch. Then another most important technique is the suction blister. So in the suction blister therapy, we choose a site, a donor site, from where we are going to get the normal epidermis. We induce the cupping therapy in that particular area. We create a negative pressure. We raise a bulla or a bleb, and then we cut that bulla from that surface and we apply onto the surface the recipient site where the patch is, and hence the color is regained within 3 to 6 months after the surgery. Now next we talk about the grafting techniques, which is the core surgery involved in vitiligo. The first method in grafting surgery is the mini punch grafting surgery, in which we take out mini punches. The punches collected from the donor area are then placed back into the recipient site, and hence the color is given by those normal skin patches into the vitiligo patch, and the color is regained within 3 to 6 months of the therapy. This procedure has got the best results. Almost more than 90% of the pigmentation is regained after this procedure, but has a very common side effect which is known as cobblestoning. It is very common after the surgery, so you get that street pavement kind of appearance with a cobblestone appearance in that the recipient site. Now next we talk about the split skin thickness graft technique, in which we take out the skin from the donor area somewhere around your thigh or your arm. We use a special knife with which we remove the skin from that area and we graft the skin into the donor site. The donor site is also prepared by dermabrasion or rubbing the skin, and hence the skin surface becomes rough. Now from the donor site, we take that graft and put it into the recipient site. There are various other small techniques that can also be used for vitiligo surgeries, like seed grafting or hair follicular grafting. Since hair follicle has a lot of melanocytes in their hair bulb, it is a great way to achieve the recoloration into the vitiligo patch. Hence these are small surgeries that can be performed on OPD basis, and hence it can help you regain your confidence. Now the most important surgeries that are usually performed for vitiligo, which is little less invasive as compared to the other surgeries, is the cellular grafting method or cultured melanocyte graft method, in which we take out the melanocytes from different maybe hair bulbs, or we take out some skin from the thigh, and then we culture the melanocytes in the culture plate, and then we put those cells into the vitiligo patch. So these surgeries are most common, has got the best results. Almost 95% of the regain of color can be achieved with these kind of techniques. So if you have any other query regarding vitiligo surgeries, you can contact us on our given number. Thank you.